Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for returning for another segment. In this segment, we'll be having a conversation with Curtis Barnett. He's joining us here as President and CEO of Arkansas Blue Cross and Blue Shield. He's going to talk about his belief in the importance of addressing behavioral health care needs at the community level through collaboration with local organizations that have demonstrated success in increasing access, improving outcomes, and basically reducing stigma. He's also going to talk a bit about why he feels it's so vital to invest in mental health care, re-examine our behavioral health service model to provide intervention from early childhood through adolescence and into adulthood, and a bit about the power of leveraging community resources and partnerships to reach those who are experiencing behavioral health challenges. Welcome to Health Professional Radio. Curtis Barnett, thank you so much for joining us.
Good morning, Neil. Great to be with you.
Glad that you could take the time. President, CEO of Arkansas Blue Cross and Blue Shield, quite a responsibility. Give us a bit of background about yourself and tell us about your role as President and CEO of Blue Cross and Blue Shield there in Arkansas.
Yeah, thank you, Neil. It's great to be with you. And in my 7th year as the President and CEO of Arkansas Blue Cross, we serve a little over 2 million members across the United States. We have the privilege of being our market's largest health insurer, and that's a responsibility we take very seriously. And I've spent nearly 30 years with Arkansas Blue Cross Blue Shield, and it is a wonderful place to work, and I have the honor to work along absolutely wonderful people. And we say a lot, we have the privilege of serving our family and friends and working with them on a daily basis. So it truly is a wonderful experience here.
Now, when it comes to mental health, what do you see as the biggest barriers to access for people who need mental health care?
Yeah, I think there are 4 areas that come to mind when I think about barriers to access. And I think the first one is really just the complexity of the system. Many people who may need care, may want to get care, really don't know where to start. If you're not familiar with the behavioral health care system, it can be very intimidating, very frustrating. How do you start? What kind of providers do you use? And how do you go about that process? That's something that we've tried to invest quite a bit of resource in to help people get started and get them to the right place, to the right care at the right time. So I think complexity is a part of it. I think a second barrier is a shortage of mental health providers. Even if people understand they need care, even if they know where to start, often there's a shortage. It may require weeks or even months before they're able to get in and see a particular type of mental health professional, especially if they need child or adolescent services or they're in a rural area. And we see a great barrier due to geography with shortages in rural areas that can keep people from getting the care that they need. So that's another area that can be a challenge. It is an area where we saw, telemedicine make a big difference over the last few years in particular, but it's still a barrier that we deal with. Cost is another one. It can be a tremendous barrier, especially if somebody doesn't have health insurance or they have a high deductible health plan, then cost can come into that, and it can cause somebody to delay care or not to receive care. And then finally, stigma is a barrier. And mental health, substance use disorders are still viewed by many as character flaws or personal weaknesses. And they're things that they don't like to talk about even with family and friends. And if they won't talk about it with family and friends, unfortunately, in too many cases, they're not getting the care they need.
Is mental health considered an integrated and an equally important part of people's health these days, or has it ever been?
I don't think there's any question that there's been a history in our industry in particular where it's not been considered to be on par with physical health. I do think that's changing, and I think I can speak certainly for the Arkansas market that we have the privilege of serving. I think the first thing that we're seeing more of now are that organizations like ours and healthcare systems, delivery systems, are making mental health a priority. We're seeing healthcare delivery systems growing their access in terms of inpatient and outpatient capacity, coordinated care plans, telehealth services. That's a great thing for the people that we all serve together. As a payer, we've made tremendous investments in what we call a whole person approach to healthcare, where we're committed to working to serve our members, to help them meet their physical health needs, their mental health needs as well as their social needs. Part of how we've done that is that we've built out our care management teams, that serve especially those who are in need of behavioral health care services. And so that we've built it out so that we have clinical leadership from psychiatrists, primary care physicians. We have nurses that are trained in behavioral health. And we have social workers that are a critical part of our organization, of our team, and they help our members really navigate this complex system that I was talking about earlier to help them get the right care, the care they need at the right time as well. We've begun recently in the last couple of years highlighting the importance of behavioral health by offering in the market. Every one of our customers or prospective customers have access to a health plan, if they choose to purchase it, that does not have any cost sharing for a certain number of behavioral health therapy visits. So that gives them a way for our members to be able to see a behavioral health therapist without having to pay a copay or co-insurance if those services are purchased. Also, we have a number of value-based reimbursement programs with providers. There's a mental health component to that. So when you talk about reimbursement, we try to make sure it's reflected there as well. And then we constantly are working with our customers and with our providers to talk about and demonstrate the value of really this whole person approach. And Bill, just going to give you just a great example of that. And, I've spent nearly 30 years in this industry, and one of the things we've always been perplexed by is how do we get control of utilization of emergency room services. That's always been a challenge for everyone, overutilization of emergency room. And the thing that we've had the greatest success in being able to decrease emergency room utilization is when we can identify somebody who's not only going to the emergency room for a physical health condition, but they also have been diagnosed with a mental health condition. And when we can help them manage that behavioral health condition, we see overall emergency room utilization go down by more than 10% in most cases. So that's a great example of how when you can treat somebody's physical health needs, their mental health needs, you can get not only better care, but also more cost-effective care as well.
Early in our conversation, you mentioned the stigma surrounding mental health and seeking mental health treatment. What is Arkansas Blue Cross and Blue Shield doing to change the stigma that surrounds mental health? Are there programs specifically designed for your healthcare workers or your case workers to deal with that? In addition to dealing with all the other complexities of the system?
Yeah, and we try to do a number of things. I think one thing that certainly comes to mind are public service campaigns in our market and in our communities where television, print, social media spots that really emphasize the importance of normalizing the conversation around behavioral health. And by normalizing the conversation, I mean help people understand that behavioral health conditions are not a sign of weakness, but a disease that needs to be treated, and then encouraging them to get the help that they need. So that's been one thing that we've done. Another has been is that we've partnered with the Arkansas chapter of the National Alliance on Mental Illness, also known as NAMI, to work with them to go into schools, junior high, middle schools, high schools, as well as colleges and universities, start chapters of really NAMI on campus is what these organizations are called, but chapters where we're bringing students together in leadership roles to help raise awareness, to help them combat stigma, and to learn how they can help their peers deal with some of the mental health issues that they're dealing with and that they're seeing within their schools. And so that's been another way that we're really addressing the stigma. And something that's occurred more recently that's had a positive impact, we think, on stigma that we really didn't expect to, kind of one of those unintended consequences, has been we've begun to employ and engage peer support specialists in our care teams that I talked about earlier. And if you're familiar with peer support specialists, these are people who are successful in recovery, so they're actually in recovery, and they have been trained as non-clinical health professionals who can help others who are going through recovery due to addiction be more successful in recovery as well. And when we began to really go to the market to identify and employ and bring those into our care teams, the reaction that we had from the broader community about the state's largest health insurer, one of the largest employers, reaching out to the recovery community in such a way gave them a legitimacy they never felt was possible before, and really felt like that was a game changer for them. And then finally, the last thing I would just mention is that we've invested this year in particular working with an organization called the Arkansas Rural Health Partnership to train Arkansans in mental health first aid. So we are going out into our communities and offering mental health first aid certification programs. We intend by the end of the year we will have certified close to 1,000 Arkansans. We want to make sure that in all 75 of our counties we have in our state that we have representation in each of those counties, and we think that's another way that we can further address stigma as it relates to mental health.
Curtis, it's been a pleasure speaking with you. Lots of great information. Hoping that you'll return and give us some updates as to how things are going there in Arkansas and in Blue Cross Blue Shield and the system overall. Thank you so much for your time this morning.
All right. Thank you, Neil. It's been great talking with you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Curtis Barnett. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.